News 8 at 5:30 in high definition continues.
Summer's here, but summer can take a toll on your heart. Earlier, Maureen McGuire sat down with cardiologist Tim Malins to talk about your heart and you.
Summer is here, and along with it, warmer temperatures and a lot of heat. So we are all going to enjoy it, but we should be careful of our heart health. And Dr. Tim, you've got some great tips on how to stay healthy in the summer. This is important for people. The heat does have an impact on your heart.
Absolutely, and it's not only with the heart, it's in general health. And so what I like about the summer is that it's warm, people get out, they will exercise. I think it's very, very important to realize that it's very hot out there. In Rochester, we get quite humid weather, so you got to remain hydrated. Some of the pitfalls with summer is that people think eat more in the winter. People tend to eat more poorly when it comes to the summertime. So the barbecues, a lot more of the red meats, as we've talked about in the past, the fatty foods, all of these things that we need to be a little bit more concerned about. I have some recommendations as far as maybe switch to, instead of the beef kebabs, have the vegetable kebabs, or have more fish in your diet. And really, when you get out to doing the exercise we talked about earlier, is you want to not necessarily push yourself as hard as you would if you were in the gym, because you can tend to lose a lot more of the fluids and the electrolytes that you normally would.
It's interesting because I know for skin health, we're told to avoid certain times of the day. Would this also apply to heart patients?
Well, it does, and I think it's in just overall health. So the highest UV index of the day is the kind of noon to 3 hour, and that's particularly the times that you can become dehydrated, especially for heart patients, and those are the patients that that I see mostly. So these people are already on things that would dehydrate them to begin with, and if they're out in the sun doing things and losing a lot of these electrolytes and fluids, they can get into a lot of trouble.
So what do you advise people who do have heart disease in the summer? I mean, don't stay inside, you know, don't be nervous, but...
Yeah, so if you're going to exercise, we want you to continue to do it, but you can always go to the gym, go to the Y, and do it in an air-conditioned type of place. Right. You can do things to where if you feel that you're not pushing yourself and you're paying attention to these things, you're eating well, you're keeping hydrated, and you're staying out of these extreme heats, then you can the summertime can be a time where you can actually improve your overall exercise tolerance.
That's good news. All right, Dr. Tim Malins, thank you.
Thank you.